Okay, we'll start. So today's topic for discussion is lymphatic drainage of the abdomen, the spleen, as well as the lower limb. So below the diaphragm. Okay. So these are the specific objectives which we'll cover. So the most important among the lymph nodes for the lower part of the abdomen and the lower limb will be the especially the inguinal group of lymph nodes. These are the most important lymphatic drainage for the lower part of the abdomen as well as the lower limbs. So here are the inguinal group of lymph nodes. They are close to the inguinal canal as well as the inguinal ligament. So that's why they are called as the inguinal lymph nodes. So the group of lymph nodes which lie below the inguinal ligament, they will be present just below the inguinal ligament. Okay, so these are the group of lymph nodes. So there are two types, horizontal and vertical. We'll talk about that. So they are present in two groups: the superficial inguinal group of lymph nodes as well as the deep inguinal group of lymph nodes. They are very much similar, except that the superficial will be superficial and the deep will be deep to the deep fascia. Okay, so that's why they are called as superficial and deep. Okay, so the superficial inguinal group of lymph nodes, which are very important clinically whenever we examine the any patient, it is said that the unless you examine the lymph nodes, the examination is not complete, and especially the inguinal group of lymph nodes, superficial inguinal group of lymph nodes. So you should know which are the areas it will be draining, and if there is any enlargement of the inguinal lymph nodes, so which are the areas we can suspect. So there are two groups among the superficial inguinal group. So they are called as the horizontal and the vertical. Horizontal and vertical. So they are also called as upper and lower. So among the upper, so they will be again divided into medial and lateral. Medial toward the center. These are the medial and these are the lateral. So the upper medial group. So this is the upper medial group. So this group will be draining the anterior abdominal wall, that is the abdominal wall, that is the anterior abdominal wall, then including the umbilicus, below the umbilicus, and all the parts near the umbilicus and below the umbilicus, then the perineum, then the external genitalia, the anal canal below the pectinate line. In the anal canal, there is a line called a pectinate line, which determines the differentiate between the ectoderm and the endoderm. So all the part of the anal canal below the pectineal line, then the external genitalia, perineum, and the anti-abdominal wall below the umbilicus. This whole region is drained by the medial group, upper medial group. Then the upper lateral group is the upper lateral group that will drain the skin and the fascia of the upper lateral side of the thigh. Okay. Then the buttocks, the flanks, as well as the back below the umbilical plane. So the same plane where we have drawn, so which will drain the medial group. So the back part of the same level will be drained by the lateral group. So first, the group of inguinal group of lymph nodes are divided into superficial and deep. Then the superficial, again superficial and deep are again classified into the upper as well as lower. So upper again divided into upper medial and upper lateral. Upper medial will be draining all these regions, and then we discuss the upper lateral, this part which will drain the skin and the fascia in the upper lateral side of the thigh, buttocks, flank, and back below the umbilical plane. Then coming to the vertical group or the lower group. So what are the regions it will drain? Okay,
Okay,
so
doctor.
vertical group will drain the skin and the fascia of the whole of the lower limb. So the whole lower limb will be drained by the
Enemy.
by the lower vertical group. This lower vertical group here, what you see here, this will drain the whole of the lower limbs. So there are three groups: upper medial, upper lateral, and lower. Okay. Then,
Hello, doctor.
yeah.
Can you send the lecture, please? Because we don't have
Okay.
it.
After the lecture,
Yes,
oh,
for this lecture.
yeah, yeah. After the lecture, I will send you.
Okay, thank you.
Okay. Okay. All the superficial lymph nodes finally drain into the inguinal as well as the external ilia group of lymph nodes. So all the superficial lymph nodes will drain into deep inguinal group. Deep inguinal group is very similar to the same as that of the superficial. So it will be divided into upper, median, lateral as well as the lower. Okay. So the superficial will drain into the deep inguinal group as well as then it will drain into the external iliac group of lymph nodes which are in the abdomen. So into the abdomen. So the superficial inguinal group of lymph nodes drain into deep and then into the external iliac group of lymph nodes. Later we'll see where exactly the external iliac group of lymph nodes are present. Then coming to the deep inguinal nodes, okay, this will drain superficial inguinal nodes as we have seen. Then popliteal nodes, then the glans penis. Glans penis is the anteriormost part of the penis. Then the deep lymphatics of the lower limb. So all the deep lymphatics of the lower limb will be drained by the deep group. The superficial group will be draining the skin and the fascia. Okay, but the deep inguinal group of lymph nodes will drain the deep part of the lower limb along with the glans penis, popliteal nodes, as well as all the superficial inguinal group of lymph nodes. So, as I said, all the superficial group of lymph nodes will drain into deep inguinal group of lymph nodes, and all deep group of lymph nodes will drain finally into the external iliac group of lymph nodes. So, finally, all this will drain into the external iliac group of lymph nodes. Now coming to the popliteal lymph nodes. Where are these popliteal nodes? If you know, the popliteal fossa is just behind the knee. Behind the knee is the popliteal fossa. This is the region. So this is called as the popliteal fossa. Within the popliteal fossa, if you see here, there are a group of lymph nodes around the arteries. Okay, so these are called as the popliteal lymph nodes. To examine these lymph nodes, you are supposed to ask the patient to flex his knee and then with both your fingers, with both the hands, fingers of both the hands, you have to press deep into the popliteal fossa to feel them because they are within the lot of pad which is present in the popliteal position. So the popliteal group of lymph nodes, they are seen in the popliteal fossa, which is the back of the knee, as I said. The drainage area will be drain the part of the limbs distal to the fossa. So whatever part that is the leg and the foot will be drained into the popliteal fossa. Whatever is distal means away from the center, below the popliteal fossa. All this region is drained by the popliteal group. Now coming to the lymphatic drainage of the abdomen. Abdomen. Okay, so the skin, the fascia, and the abdominal wall drains into the superficial group of lymph nodes as we saw. Okay, then the abdominal organs and other deep structures drain into the pre-aortic as well as the para-aortic. If you see here, this is the aorta. So all the organs in the abdomen, they will be draining into some group of lymph nodes which are in the front of the aorta. They will be called as the pre-aortic, and which are on the sides, they are called as the para-aortic group of lymph nodes. Pre means in the front, para means beside the aorta. Then we have the common iliac. This is the common iliac artery. Just beside the common iliac, you can see the common iliac group of lymph nodes. Then we have the internal and external iliac group of lymph nodes. If you see here, the common iliac artery divides into internal and external iliac artery. So whatever group of lymph nodes are near the internal group, internal iliac artery, that will be called as internal iliac nodes, and whatever is near the external iliac artery, those will be called as the external iliac group of lymph nodes. So the blue one are the external iliac group of lymph nodes. These brown colored are the internal iliac, and these are the common iliac group of lymph nodes. And these are the pre and para-aortic group of lymph nodes. So again, they are classified into the celiac group of lymph nodes, hepatic group of lymph nodes, lumbar group of lymph nodes. All these are the different classification of the group of lymph nodes. Remember, these group of lymph nodes cannot be palpated because they are deep inside the abdomen, so you cannot palpate them. So if you want to see their enlargement, you have to take an X-ray or sometimes the CT scan and the MRIs to detect any enlargement of these group of lymph nodes. Now coming to something called as a specialized feature which is present in the intestine, that is called as the Peyer's patches. So if you see the GIT is potential portion for infection, because we have food and other products which will be going from the external environment into the body. So it has a potential for the infection. So it can carry many bacteria and virus. Hence, they are protected by an aggregation of lymphocytes. So there will be aggregation of lymphocytes forming lymphoid follicle. So there will be aggregation of lymphocytes, which are called as lymphoid follicles, and they have a special name in the intestine. The whole of the intestine, they are special name called as the GALT. GALT means gut associated lymphoid tissue. Similarly, in respiratory system, there is something called as RALT, respiratory associated lymphoid tissue. So in each region, there will be collection of lymphoid follicles, the aggregation of lymphocytes called as the lymphoid follicles. And especially they are important in the intestine. And these Peyer's patches, the not the Peyer's patches, the gut associated lymphoid tissues are especially seen in the esophagus, small intestine, and large intestine, as well as a huge aggregation in the appendix. Especially in the lamina propria and submucosa of the ileum, contains aggregation of lymphoid follicles which are very much specialized, and they're called as Peyer's patches. If you see here, this is the picture showing you the Peyer's patches. So these are nothing but the aggregation of the lymphoid follicles, aggregation of lymphocytes called as the lymphoid follicles, and they are huge in this region. In other parts of the GIT, they are present but very few, but especially in case of the ileum and the appendix, they are hugely aggregated, and they have a special name called as the Peyer's patches. Peyer's is the scientist who found this, and on his name it is called as Peyer's patches. And these are very important, especially in typhoid fever. Typhoid fever, these get infected and then it can lead to sometimes even perforation and severe peritonitis. Okay, so these Peyer's patches are very important. So there are around 30 patches seen in case of the human beings. So in case of human beings, you can see these aggregation of the lymphoid follicles called as Peyer's patches in the ileum, and they are almost 30 in number, and each patch consists of 10 to 200 nodules. So the range for each patch differs from 10 nodules to almost 200 nodules seen with the naked eyes. If you take a section, cross section, then even with the naked eyes, you can see some patches. Okay. Or sometimes you can use the hand lens to see them. So Peyer's patches appear as dome-shaped area devoid of villi. If you see here, the whole of the intestine is filled with villi. Everywhere you can see the villi. But just in front of the Peyer's patches, if you see here, they are dome-shaped and they are devoid of any villi. There are no villi on this part. Okay, so that is how you can identify the Peyer's patch. Here is the second one. So it is dome-shaped and there are no villi on that. In other parts, you can see the lot of villi. Okay, so they are devoid of villi and they are dome-shaped areas, and they're covered by a special epithelium consisting of M cells. So there will be specialized cells, epithelial cells called as M cells, or the endothelial cells to be more specific, and they are not absorptive cell. In all the parts of the intestine, there are absorptive cells, but in case of the this near just above the this space patches, you see M cells, specialized cells, not absorptive cells. Now coming to one more very important organ, that is called as the spleen. Till now what we were seeing is the aggregation of the lymphoid follicles, but they are not called as organ. But the most important organ in case of the lymphatic system is the spleen, which is also called as the lean or spleen. So there are different names for the same organ. So the spleen, as you know, is the largest single mass of hemolymphatic organ. So it acts as both a hemopoietic as well as the lymphatic organ in the body, and belongs to the reticuloendothelial system. So this is the largest single mass of the hemolymphatic organ. And this is present in the left hypochondrium. If you see here, just beside the stomach, this is where we can see the spleen, just behind and beside the stomach. On the lateral side, you can see in the left hypochondrium. On the right side, we have the liver. On the left side is the spleen. So it is present especially in the hypochondrium, and a part of it even enters the epigastrium. If you see here, this part is projecting even to the slightly into the epigastrium. So it is wedged between the fundus of the stomach and the diaphragm. If you see here, it is compressed between the diaphragm and the stomach, especially when the stomach is full, it is compressed between the stomach and the diaphragm. So that's what it means by the word wedge. Wedge means it is compressed between the two structures, fundus of the stomach and the diaphragm. And the shape is wedge shape or it is tetrahedral shape, and the weight and the size is in the form of a dictum called as the Harris dictum. So it is 1357911. 1357911. So what is this Harris dictum? So it is 1 inch thick. If you see here, this is the spleen here. So if you measure this thickness, almost 1 inch in thickness and 3 inches in breadth. 3 inches in breadth, and the length of the spleen is almost 5 inches. 5 inches, and the weight is almost 7 ounces. 7 ounce, and it is between the ninth and the 11th rib. It is between the ninth and the 11th rib. I later will show you so how it is in relation to the ribs. Okay, so this is called as the Harris dictum. 1, 3, 5, 7, 9, and 11. So 1 inch in thickness, 3 inches in breadth. So this is the thickness of the spleen here. So this is 1 inch in thickness, and breadth is almost 3 inches, length is 5 inches, the long axis is called as the length, and the weight is almost 7 ounces, and it is between the ninth and the 11th rib. If you see, the ninth rib will be on the top and the 11th rib will be on the below. So it is passing just like that of the in the position of the 10th rib. Okay, so it is in relation to the ninth and 11th rib on the left side, because the spleen is on the left side, so naturally it will be related to the ninth and 11th rib on the left side. Coming to the position of the spleen, or it is also called as the long axis of the spleen. So the length, through the length, if you put a line, that is called as the long axis. So it lies obliquely along the long axis of the 10th rib. As I said, it is between the ninth and the 11th rib and in the position of the 10th rib, and makes an angle of 45 degree. So it is in the angle of 45. So see here, this is how it is present. So this is like this 45 degree, and above will be the ninth rib and below will be the 11th rib, and the 10th rib will be here. If you see here, this you can see here. So this is the 10th rib, 11th rib will be below, 9th rib will be up. Okay, so lies obliquely along the long axis of the 10th rib and makes an angle of 45 degree with the horizontal. So it is directed downwards, forwards, and lateral. As you can see here, it is directed, long axis is directed downwards, forwards, and laterally. Now coming to the external features, what do you see when you see a spleen? This is how the spleen will look like. Okay, so these are the two different surfaces shown in different positions. Okay, so it is the soft, highly vascular, dark purple in color. This is how it looks like. It is almost purple in color, highly vascular, because always there will be some quantity of blood stored in this spleen, and it is soft in nature because there is no any bone as such. It has two ends. One is called as the anterior end. If you see here, so this is the anterior end and this is the posterior end. Posterior end will be behind, as you can see in this picture. So here will be the posterior end. This will be the anterior end. Okay. So it has two ends, the posterior end and the anterior end. So it is also called as the lateral and the medial. This is called as medial and this is called as the lateral end. And there are three borders. One is called as the superior border, very important border, which has notches. If you see here, these are the notches. So these are the notches which you feel whenever you try to palpate the spleen. If there is hepatomegaly, normally you cannot feel the spleen when you palpate the abdomen. If there is hepatomegaly, you can feel an organ. And if it shows notches, when you feel it, you can feel the notches, especially if it is from the spleen. There is hepatomegaly and you are feeling the spleen exactly, not the any other organ, then you can feel these notches. So these notches are very important clinically. So this is the superior border, which is notched. Then we have the inferior border. Then we have the intermediate hilum. So there is the superior border here. Then we have the inferior border. This is the inferior border here. If you can see here, this is the inferior border. Then we have the hilum. This is the hilum. What is the hilum? That is the root of the any organ, or it is also called a hilum, where the structures will be entering or coming out. This is called as the hilum of the spleen. Then coming to the two surfaces, there are two surfaces. One is in contact with the diaphragm, that is called as the diaphragmatic surface, and this which is in contact with the viscera, the abdominal organ, that is called as the visceral surface. This is how actually it is present. This is how it is present. Okay, the visceral surface will be facing forwards because the spleen is behind, and the diaphragmatic surface will be in contact with the diaphragm. So if you see here, this is how it is present. So the diaphragmatic surface is in contact with the diaphragm, and the visceral surface is in contact with the viscera of the abdomen. So here, okay, then this is their actual position. So it has two surfaces, as I said, diaphragmatic and visceral surface. Diaphragmatic surface will be smooth, and the visceral surface will be irregular, and it shows impressions of, there are four important impressions. One is for the fundus of the stomach, as you can uh, identify, as you can see in the previous picture. So here is the fundus of the stomach. So if you can see here, here is the fundus of the stomach. So this is the fundus of the stomach. So it will be in contact with the upper part of the spleen. Okay, so this is the fundus of the stomach, where the gastric impression will be there. So here you can see here is the fundic impression. Then we have the anterior surface of the kidney. If you see here, here is the kidney here. Okay, so that will be in contact with the this part. So this is the renal impression. So this is the gastric impression. This is called as the renal impression. Then we have below, then we have the splenic flexure of the colon will be contact here. So if you see here, this is the splenic flexure of the colon, the bend, the transverse colon bend and continue as the descending colon. That bend is called as the splenic flexure. Flexure is the bending, and because it is near the spleen, then it is called as splenic flexure. So here also there is a bend of the transverse colon. This is called as hepatic flexure, because liver is present here, so it is called a hepatic, and this is called as the splenic. This is also called as the left flexure or the splenic flexure, to be more specific. Then also you can see the tail of the pancreas. Here is the tail of the pancreas. A very important relation is the tail of the pancreas. Okay, so the tail of the pancreas will be in relation to the spleen. So this is very important, especially when you are doing the splenotomy. Now coming to the peritoneal relations. Okay, the spleen is surrounded on all sides by the peritoneum and is suspended by the following ligament. So the spleen is covered by the, if you see here, this is the blue line covering the all parts of the spleen. Okay, and it is suspended by some ligaments which will hold the ligament spleen in the upper part of the abdomen. One is called as the gastrosplenic ligament. There is a ligament between the peritoneal fold between the fundus of the stomach and the spleen. That is called as the gastrosplenic ligament. Then we have the second ligament, which is very important. That is called as the leno-renal ligament. Leno means the other name for the spleen, and the renal. Okay, so the kidney, between the kidney and the spleen. But there is also a very important structure, that is the tail of the pancreas, as we saw before. So the tail of the pancreas is near the hilum, this part. Okay, so which will give the impression. So this relation is very important. As you can see here, this is the tail of the pancreas, and this is the leno-renal ligament containing the tail of the pancreas as well as the splenic vessels, as well as in relation to the spleen and the kidney and the tail of pancreas. This is especially important during splenotomy. As I said, whenever there is injury of the abdomen, usually the spleen starts bleeding. Okay, then you are supposed to do the splenotomy. So when you do the splenectomy, you should be very careful to cut the spleen along with this ligament, lienorenal ligament. So because the tail of the pancreas is very close, actually it is not so far, it will be so close to the hilum that when cutting, a part of the tail of the pancreas is also cut. And as you know, the tail of the pancreas will contain the islets of Langerhans, the endocrine part of the pancreas, which will secrete the insulin. So when you cut the tail of the pancreas, then you will induce diabetes because now because most of the islets are present in the tail, and if you cut that during splenectomy, that is called as induced diabetes. You are producing the diabetes. Okay, inducing the diabetes into the patient because by surgical cutting of the tail of the pancreas. So that's why this relation is very important, the lienorenal ligament. Then there is also a ligament between the spleen and the diaphragm. This is called as the phrenicocholic ligament. Phrenicocholic ligament. All these ligaments will hold the tail of the spleen in its position. Now coming to the blood supply of the spleen, it is supplied by a very important artery called as the splenic artery. Splenic artery, if you see here, so this is the splenic artery. It is a branch from the celiac trunk. Okay, and this is the splenic artery, very tortuous artery coming and entering into the hilum of the pancreas, the spleen, which is tortuous in its course and passes through the lienorenal ligament as you saw here. So in the previous picture, if you see here, this is the same splenic artery. So it is passing through the lienorenal ligament, due to ligament here on either side. Okay, so it is passing through the lienorenal ligament and to the ligament to reach the hilum of the spleen. As it reaches the hilum of the spleen, where it divides into 5 or more branches. As you can see here, there are multiple branches. Before it enters the spleen, it divides into 5 or more branches and then enter the spleen. So it doesn't go inside and then branches, but it branches outside and then enters. Even if you see this previous picture, you can see here is the branching. Then it enters the spleen. Now coming to the venous drainage, it is by the splenic vein. So here you can see here this is the same splenic vein. So before you saw the splenic artery, this is the splenic artery from the abdominal aorta and from the celiac trunk. Now, if you can see here, this is the splenic vein. This is also tortuous, which joins the superior mesenteric vein to form the portal vein, very important vein. Splenic vein draining the spleen along with other organs, and it joins with this superior mesenteric vein to form a very important vein called as the portal vein. This is the portal vein. Okay, so splenic vein which joins with the superior vein to form the portal vein. Coming to the nerve supply, it is by the sympathetic fibers derived from the celiac plexus because everything is coming from the celiac. This is the celiac trunk, and beside that will be the celiac plexus, which is vasomotor. Now coming to the development of the spleen, because I was talking about the notches, so you should know what are the notches here, which are present in the spleen. Okay, which I said is very important when palpating. You can identify the spleen, you can make out that this is spleen by the notches which are present in the anterior border. So the spleen develops in the 6th week of intrauterine life from the cephalic part of the dorsal mesogastrium from its left layer. Okay, so this develops in the 6th week of intrauterine life. Initially, it will develop into a number of nodules. Initially, it will be in the form of multiple nodules, which later fuse. That's why you can see the notching, because it means they were different nodes initially, then they all fuse together. But they are incompletely fused, so that's why you can see the notches. Hence, we see notching of the superior border of the adult spleen. So that's why you see the superior border has a notching. Okay, because of these nodules which are incompletely fused together. Coming to the accessory spleen, sometimes what happens, these splenic nodules don't fuse together. Sometimes they remain as separate. Okay, especially small pieces and chunks. So these are called as the spleniculi. Spleniculi. It appears when splenic nodules fail to consolidate in embryo, then these are seen at different places. like the broad ligament of uterus. Sometimes it will go into the pelvis. Spleen is in the upper part of the abdomen. Sometimes a small part of it might go into the broad ligament of uterus. Sometimes it might be seen in the spermatic cord. Sometimes it can be seen in the gastrosplenic ligament, renal ligament, gastrosplenic ligament, as well as the grammatrometer. These are the different areas where the accessory spleens have been detected till now. Okay, so this is the spleen. So this is all about the spleen as well as the lymphatic drainage of the lower limb as well as the abdomen. Okay, so for the abdomen and lower limb, the most important will be the superficial as well as the deep inguinal group of lymph nodes. Superficial inguinal group of lymph nodes will drain into deep. Deep will drain into the external iliac group of lymph nodes. Then we have seen in the abdomen, we have the different group of lymph nodes within the near the aorta, uh, pre-aortic, para-aortic, then common iliac, external iliac, and interiliac. Then we discuss about the details about the spleen. Okay. Then we also discuss something about the gut-associated lymphoid tissue, especially seen in the ileum called as Peyer's patches. So this is all about this lecture. If you have any questions regarding this, you can ask me.
Thank you, doctor.
Okay, if you don't have questions, okay, thank you very much.